Now, a heart attack is a condition where there's decreased blood flow going to the heart muscle. Now, this could lead to a cardiac arrest or not, but most cardiac arrests are not necessarily from heart attacks. So not all heart attacks lead to cardiac arrests, and not all cardiac arrests come from heart attacks.
Here is your heart. Please know the symptoms of a heart attack. In case it's yourself or a loved one: chest pain, heavy squeezing, constant ache behind the breastbone, pain that radiates to the back area, the left jaw, the left arm, excessive sweating and cool and clammy skin, nausea, vomiting, or feelings of severe indigestion, shortness of breath, dizziness, or even lightheadedness. And this is where seconds count. So the earlier you recognize these signs and symptoms, get emergency help. Remember, it's your life.
Heart failure doesn't always start with chest pain. Your body gives subtle warning signs long before a heart attack strikes. From swollen legs to persistent fatigue, even something as unexpected as gum disease could mean your heart is in trouble. Ignoring these symptoms can be deadly, but catching them early can save your life. In this video, we'll uncover 13 shocking signs of heart failure you must not ignore. Stay until the end for 5 crucial steps to protect your heart. Number 1. Swollen calves and ankles. Swollen calves and ankles might seem like minor issues. Maybe you think you just walked too much or ate something salty. But if the swelling keeps coming back or gets worse at night, your heart might be struggling.
I'm going to talk about another symptom that could be related to your heart. And that's ankle swelling. So if you see that your ankles swells up or your feet becomes puffy, that could be a sign that your heart might not be pumping well, or the pressure inside the heart is up. If you do get these symptoms, you can always talk to your doctor and see if you need to have cardiac assessment. In doctoral cardiology, we provide bulk billing, consultation, and cardiac services.
Here's what's really happening. When your heart isn't pumping properly, blood starts pooling in your lower legs. This causes fluid to leak into the surrounding tissues, making your calves and ankles puff up like balloons. And no, this isn't just about standing too long. It's a major red flag that your heart isn't keeping up with its job. But wait, it gets even trickier. Many people shrug it off thinking, oh, it's just water retention. Maybe they try to cut back on salt or put their feet up for a bit. But if your heart is the culprit, that swelling won't go away so easily. It might even get worse as the day goes on. This could mean your heart is struggling to pump blood efficiently, leading to fluid buildup that may also cause shortness of breath. And trust me, that's not a situation you want to let slide. So what should you do? First, take note of when the swelling happens. If it's only after a long day on your feet, it's probably nothing to panic about. But if it's persistent, gets worse at night, or is paired with other symptoms like dizziness or chest discomfort, this is your sign to see a doctor. Number 2. Bleeding gums and gum disease. Bleeding gums might not seem like a big deal. Maybe you just brushed too hard, right? But what if I told you that your gum health is directly connected to your heart? Here's the shocking truth. Studies suggest a strong link between gum disease and heart disease, possibly increasing the risk by up to 50%. That's not just a random number. Research supports this connection.
Can gum disease really cause a heart attack? Technically, the answer is yes. It can contribute to increasing your risk of having a heart attack. This is because gum disease increases your risk of heart disease, and heart disease leads to heart attacks.
But how does something as small as your gums affect something as vital as your heart? It all comes down to inflammation. When your gums are inflamed, they become a breeding ground for harmful bacteria. These bacteria don't just stay in your mouth, they enter your bloodstream and trigger inflammation throughout your entire body. And guess what? That same inflammation is what fuels heart disease and clogs your arteries with dangerous plaque. And here's where it gets really scary. This isn't just about bad breath or a little blood when you floss. If your gums are constantly inflamed, your risk of a heart attack skyrockets. Why? The bacteria from gum disease can contribute to arterial stiffness, making it harder for blood to flow properly. And when blood flow is restricted, that's when heart attacks happen. Now you might be thinking, but I brush my teeth every day. Well, here's the thing. Brushing alone isn't enough. If you're not flossing, you're leaving behind bacteria that hide between your teeth and under your gums. Over time, this buildup leads to gum disease, and before you know it, your heart is at risk. So, how do you protect yourself? It's simple. Take your oral health seriously. Brush and floss daily, use an antibacterial mouthwash, and don't skip those dentist visits, because catching gum disease early could literally save your life. Number 3. Loud snoring and sleep apnea. Snoring might seem like just an annoying habit. Maybe your partner complains about it, or you wake up feeling groggy. But what if that loud snoring is actually a warning sign that your heart is in danger? Here's the deal. If you snore loudly, stop breathing for a few seconds, or wake up gasping for air, you might have sleep apnea. Sleep apnea is no joke. It's strongly associated with high blood pressure, heart failure, and even sudden cardiac arrest. But how does snoring mess with your heart? Every time you stop breathing, even for a few seconds, your oxygen levels drop. This forces your heart to work harder, putting a massive strain on your cardiovascular system. Over time, this increases your risk of irregular heartbeats, stroke, and even heart failure. And here's the scariest part. Most people don't even realize they have sleep apnea. They just feel exhausted during the day, wake up with headaches, or assume their snoring is harmless. But if your snoring is loud, persistent, and paired with choking or gasping at night, this is your wake-up call. So, what's the solution? Get checked for sleep apnea. A simple sleep study can confirm if you have it, and treatments like using a CPAP machine can literally save your life. Don't ignore this one. Snoring isn't just a sleep issue, it could be your heart begging for help. Number 4. Sudden weakness and fatigue. Feeling tired after a long day is normal. But what if you're constantly exhausted even after a full night's sleep? What if simple tasks like climbing the stairs or carrying groceries leave you completely drained? That's not just being out of shape. It could be your heart struggling to keep up.
Second category is lightheadedness, dizziness, or any other kind of pain. The person may have nausea, vomiting, perspiring. They may have pain radiating to the neck, the jaw, the throat, the abdomen, or even the back.
Sudden weakness and extreme fatigue are huge red flags for heart disease, especially in women. And here's why. It all comes down to oxygen. Your heart's job is to pump oxygen-rich blood to every part of your body. But when it starts to fail, that oxygen supply drops, leaving you feeling weak, sluggish, and completely wiped out. And here's the scary part. Many people ignore this symptom because it creeps up slowly. Maybe you start feeling winded doing things that never used to bother you. Or you notice that no matter how much you rest, you still feel exhausted. If that sounds familiar, pay attention, because this kind of fatigue doesn't just go away on its own. For women, this is especially dangerous. Unlike men, who often get the classic chest pain warning before a heart attack, women are more likely to experience unexplained fatigue instead. In fact, many women have reported feeling extreme tiredness weeks before a heart attack without realizing their heart was in trouble. So, how do you know if it's just regular tiredness or something more serious? Look for other symptoms. If your fatigue comes with shortness of breath, dizziness, swelling, or chest discomfort, this could be a sign of an underlying heart issue. Don't ignore it, check with a doctor. Number 5. Skin rashes and unusual spots. Most people don't connect skin problems with heart disease. After all, a rash seems like a minor issue, right? Maybe it's an allergy, a new soap, or just dry skin. But what if your skin is actually warning you about a deeper problem in your heart? Here's the shocking truth. In some cases, heart conditions may contribute to unusual skin changes, including red rashes, unexplained spots, and even a bluish or purplish tint. And it all comes down to poor circulation and inflammation. When your heart isn't pumping blood properly, your body struggles to deliver oxygen and nutrients to your skin. This can lead to discoloration, dryness, and even slow healing wounds. If your skin suddenly looks blue or purple, especially on your lips, fingers, or toes, that's a sign your blood isn't carrying enough oxygen, a major red flag for heart failure. But it doesn't stop there. Inflammation caused by heart disease can also trigger rashes that won't go away. Some people develop reddish or brown patches on their legs due to poor blood flow, while others notice tiny red spots under the skin, especially on the hands and feet. These could be signs of a serious heart infection, known as endocarditis. The worst part? Most people ignore these signs. They assume it's just eczema, an allergic reaction, or aging skin. But if your skin suddenly changes color, if rashes won't heal, or if you notice unusual spots appearing out of nowhere, your heart might be in trouble. Number 6. Unexplained nausea and indigestion. Feeling a little nauseous after a big meal? No big deal. But what if that nausea comes out of nowhere with no obvious reason? What if it feels more like a deep discomfort in your stomach rather than just bad food? Believe it or not, unexplained nausea and indigestion could be signs that your heart is in trouble.
The third sign of a possible heart attack is actually abdominal pain and nausea. Now, a lot of things can cause that, but if you have risk factors for heart disease and you're over the age of 50.
Here's why. When your heart isn't getting enough oxygen, it can sometimes cause discomfort in the upper stomach instead of the chest. This is especially common in women, who are more likely to experience nausea, indigestion, or even vomiting during a silent heart attack. And because it doesn't feel like the classic chest pain, many people dismiss it as just a stomach issue. But here's what makes it dangerous. This type of nausea doesn't come from something you ate. It lingers. It's often paired with cold sweats, dizziness, or shortness of breath. Some people describe it as a heavy, burning sensation in the upper abdomen that just won't go away. Sound familiar? It could be your heart struggling. So, what should you do? If you suddenly feel nauseous, especially along with other symptoms like fatigue, dizziness, or pain in your jaw or back, do not ignore it. It's better to get checked and be safe because sometimes the only warning sign of a heart attack is hidden in your stomach. Number 7. Chronic cough or hoarseness. A cough that won't go away is usually blamed on allergies, a cold, or even acid reflux. But what if that persistent cough is actually a warning sign of heart failure?
That could be a version of congestive heart failure where the blood flow is backing up into not just your ankles, but into organs and your lungs and creating this irritation or a cough.
Here's what happens when the heart starts to weaken. It struggles to pump blood efficiently. This can lead to fluid buildup in the lungs, causing a chronic, nagging cough. Some people even notice pink or frothy mucus when they cough, which is a huge red flag for heart failure. It's not just coughing. Hoarseness or a raspy voice can also be linked to heart problems. Why? Because fluid buildup can press on the vocal cords, making your voice sound different. The key warning sign? If your cough gets worse when you're lying down but improves when you sit up, your heart could be the cause. If you also experience shortness of breath, fatigue, or swelling in your legs, don't ignore it. A lingering cough isn't always just a lung issue. It could be your heart struggling. If your cough won't go away and you can't explain why, it's time to get checked. Your heart might be trying to tell you something. Number 8. Fainting spells. Syncope. Fainting might seem harmless. Maybe you skipped a meal or stood up too fast. But what if your fainting spells are actually a sign that your heart isn't pumping blood properly? When blood flow to the brain suddenly drops, you black out. This can happen if your heart has an irregular heartbeat, arrhythmia, or if it's too weak to push enough oxygen-rich blood to your brain. And here's the scary part. Sometimes, fainting is the only warning sign before a serious heart event, like a heart attack or stroke. If you've ever felt dizzy, lightheaded, or completely passed out for no clear reason, this is not something to brush off. Especially if it happens more than once. Some people also feel a racing or skipping heartbeat before fainting, which could mean their heart is struggling. Unexplained fainting is a big deal. If it happens even once, especially with chest pain, shortness of breath, or palpitations, get checked immediately. Your body is sending you a message, and ignoring it could be dangerous. Number 9. Sudden excessive sweating. Breaking a sweat during a workout? Totally normal. But suddenly dripping in sweat for no reason, especially if it's cold, clammy sweat, could be a serious warning sign from your heart. Here's why. When your heart is struggling to pump blood efficiently, your body goes into panic mode, activating the nervous system. This causes excessive sweating, even if you're sitting still. It's especially concerning if you wake up drenched in sweat at night, or if you suddenly feel cold and clammy without exerting yourself. And here's the biggest red flag. Cold sweats can be an early sign of a heart attack. Many people experience profuse sweating before chest pain or other symptoms kick in. Women, in particular, may get night sweats as an early warning. The key takeaway? If you're sweating excessively for no clear reason, especially with dizziness, chest discomfort, or nausea, do not ignore it. This isn't just overheating. It could be your heart in distress. Number 10. Anxiety and panic attacks. Ever felt your heart racing, your chest tightening, or a sudden wave of dizziness and thought, is this anxiety or something worse? You're not alone. The symptoms of a panic attack and heart problems can feel almost identical. Here's the shocking part. Heart disease can actually trigger anxiety-like symptoms. When the heart struggles to pump blood properly, it can cause shortness of breath, dizziness, and even chest pain mimicking a panic attack. Studies show that people with heart disease are more likely to experience frequent anxiety or panic episodes. The key difference? Heart-related anxiety often strikes suddenly and isn't tied to stress or a specific trigger. If you feel anxious out of nowhere, especially with palpitations, chest discomfort, or cold sweats, your heart could be the real culprit. If your anxiety feels different or keeps happening, get checked. It might not be in your head. It could be in your heart. Number 11. Difficulty exercising or climbing stairs. If you get winded after running a marathon, that's normal. But feeling out of breath just from climbing a few stairs or walking across the room, that's a red flag.
The second concerning sign is sudden onset shortness of breath. If you're not really doing anything but you feel like you've just run a mile, it could be a sign that your heart is struggling to function properly and fluid is backing up into your lungs. So if you get sudden onset shortness of breath, get straight to an emergency room.
When the heart isn't pumping blood efficiently, your muscles and organs don't get enough oxygen. The result? Extreme fatigue and shortness of breath, even during simple activities. Some people even feel like they can't catch their breath while lying down. This isn't just about being out of shape. If you suddenly struggle with everyday movements that never bothered you before, your heart could be in trouble.
It gets confused. And the third thing is changes in your ability to exercise, lower exercise tolerance. If you're walking upstairs or doing something that shouldn't be strenuous and you're having a hard time breathing, you have to stop.
Difficulty exercising is one of the earliest signs of heart failure. If basic activities leave you gasping for air, don't ignore it. This could be your heart warning you before something serious happens. Get checked before it's too late. Number 12. Cold hands and feet. Cold hands and feet in winter? Totally normal. But freezing fingers and toes all the time, even in warm weather, that's a major red flag for poor circulation. When arteries start to narrow due to plaque buildup, blood struggles to reach your extremities. The result? Constantly cold hands and feet, sometimes even turning pale or bluish. This is often one of the earliest signs of arterial blockages, which can lead to serious heart problems. Some people also feel numbness, tingling, or a pins and needles sensation. Another clue that blood flow isn't reaching where it should. If your hands and feet always feel ice cold, even when the rest of you is warm, your heart could be struggling to pump blood efficiently. Poor circulation is a warning sign, not just an inconvenience. If your hands and feet stay cold no matter what, get your heart checked ASAP. Number 13. Chest pain? When to worry. Chest pain doesn't always mean a heart attack, but it's never something to ignore. If you feel pressure, tightness, or a squeezing sensation in your chest, especially if it spreads to your arm, jaw, or back, get help immediately.
Tightness in the chest. And the second category is lightheadedness, dizziness, or any other kind of pain. The person may have nausea, vomiting, perspiring. They may have pain radiating to the neck, the jaw, the throat, the abdomen, or even the back. You could have pain going down the arm. Those nerve fibers run along with those cardiac nerves, so the brain gets confused.
Heart-related chest pain often comes with shortness of breath, nausea, dizziness, or cold sweats. It can start mild and gradually worsen. Even brief, sharp pains could signal an underlying heart issue. If you're unsure, don't wait to get checked. When it comes to your heart, it's always better to be safe than sorry. Proven ways to strengthen your heart. Your heart works 24/7 to keep you alive, so why not give it the care it deserves? Here are 5 science-backed ways to keep your heart strong and healthy. First, eat like the Mediterranean. A diet rich in olive oil, fish, nuts, and fresh vegetables can help lower bad cholesterol and reduce inflammation. It's delicious and heart-friendly.
Just a little health reminder to make sure you're getting your garlic in your diet, because garlic decreases the stickiness of platelets. This is when the cell-like structures in the blood start to clump together. This eventually can form clots and lead to heart attack and stroke. So when you eat your garlic, this will prevent that stickiness from occurring in the arteries to keep you healthy.
Second, get moving. Just 30 minutes of walking daily can improve circulation, lower blood pressure, and keep your heart strong. No need for an intense workout. Just stay active. Third, know your numbers. Keeping an eye on blood pressure and cholesterol can help catch heart issues before they become serious. Fourth, ditch bad habits. Smoking damages arteries, and too much alcohol raises blood pressure. Cutting back can drastically lower your heart disease risk. Finally, prioritize sleep. Getting 7-9 hours of good sleep supports heart function and reduces stress on your cardiovascular system. Take care of your heart. It's the only one you've got. Your heart sends warning signs. Are you listening? If you've experienced any of these symptoms, comment yes below. Your story could help someone else recognize the signs before it's too late. And don't forget that taking care of your heart starts now. Hit that like button if you found this helpful, and subscribe for more life-saving health tips. Your heart deserves the best. Let's keep it beating strong together.